Hello, this is Brett Rentmeester, President of WindRock Wealth Management. Thank you for joining us today on our interview on wealth and health. Some of our listeners may be wondering what wealth and health have in common. For some, wealth refers simply to material achievements. However, during my years of consulting with wealthy families and investors, I found that once people achieve material wealth, the real wealth they seek are in things like health, family, travel, and other life experiences. Health is fundamental to everything we do, yet today's healthcare system is very broken and focused on treating illness rather than preventing them. Despite amazing advancements, a larger and larger percentage of the population are either suffering from or even dying from things that can be largely avoided and cured. With that backdrop, I've been a passionate supporter of integrative medicine, and I'm thrilled to be here today with one of the leading minds in integrative medicine and the future of healthcare at large, Dr. Melinda Ring. Dr. Ring is the medical director at the Osher Center of Integrative Medicine at Northwestern, one of the leading integrative medical centers in the world. She has her medical degree from the University of Chicago and also spent some time working with Dr. Andrew Weil in Arizona. Dr. Ring, thank you for being with us.
Thank you so much for having me.
Why don't we just start at the top? Why don't you tell our listeners what integrative medicine is and why it might be something worth understanding?
So integrative medicine is, sometimes it's called the new medicine, but to me it's really just a return to the old type of medicine. Integrative medicine looks at different types of approaches of healing and different traditions from around the globe that have evidence for efficacy and combines them with some of the traditional Western medicine approaches that we're used to. So it's a holistic approach, it's a broader global approach, but more importantly than just using acupuncture instead of a pain medication or taking turmeric for inflammation, really what we're talking about is a return to the philosophy of how medicine should be practiced. Some of the basic tenets of that are that we should be focusing on prevention, not just on diagnosing and treatment, that we should be looking at the whole person, so not just what ache and pain they have or what disease they have, but what's going on in their life, what's happening in their community, in their family, in their emotional state, in their spiritual life that's impacting on their health. It emphasizes the importance of the relationship between the healthcare provider and the patient. So oftentimes now we're stuck with 15-minute visits if you're lucky with your doctor, and it's once a year, and it's hard to really develop a relationship that has the power to heal. And also there's a very big focus on lifestyle and a recognition that we need to not just focus on invasive procedures and expensive diagnostic tests, although we want to use those when we need them, but that we should be remembering that the core of health begins with diet and physical activity, getting adequate sleep, and managing stress.
Back to the basics.
Back to the basics, exactly.
Well, that's a very good overview. And, I've seen a number of people who have dealt with health situations and found integrative medicine to be the solution they were looking for. I'd be interested in hearing your perspective on the different conditions where you've seen integrative medicine make a real difference across the spectrum of maybe life-threatening things all the way down to chronic things. Can you give us a little bit of an overview on your experiences?
Sure. So I'd say there are three major categories of patients that tend to seek out integrative medicine. The first category is that of patients who have thoroughly sought help for their condition in the Western medical system for things that aren't necessarily treated well, or there's not adequate answers in terms of how to treat it. So things like irritable bowel syndrome or fatigue or food sensitivities and hormone imbalances, chronic pain. And a lot of times patients come and they're frustrated because they don't feel well, but their doctor has told them that everything on their tests is normal, so therefore they're fine. And really, the patient's frustrated and they're seeking additional help and additional answers, and so they'll end up at our door. The second category, I'd say, is patients who have a family history of something like Alzheimer's or heart disease or cancer, and they say they'd really like to make sure that they can do whatever they can to prevent that condition from happening. And that's another area where we can really help people. And then the third category are people who have it just fits their philosophy of how health should be, and they recognize that there's value in this holistic approach to care. So they come to integrative medicine.
Great. Now, what about people that are healthy, and maybe it's that last group you're talking about, that it kind of fits their philosophy. But a lot of our listeners might be wealthy people who are generally healthy, but wondering, how do I age better, live longer,
Sure.
feel better every day? What are some of the things that people are seeking when they come and see you in that regard, of how to just optimize health? Or what are some of the things that are available today to think about?
Well, I'd say, I see all different kinds of patients. I certainly have my extremely high-functioning executive level, or people who are in a certain stratosphere of life where they are healthy, but they're not necessarily well. And a lot of times people think that they are okay because they don't have a major disease, but they may not necessarily feel vibrant, and they may not feel at their optimal health. And sometimes they don't even know that they don't feel at their optimal health until they start to feel better. And all of a sudden they realize, wow, I just thought it was aging. I thought it was normal for me to just feel tired every day, or that I couldn't eat these foods that I used to eat, or that, I get sad or more irritable than I used to. I think one of the most important things to do is to be willing to look beyond just the usual tests that get done. And there's a whole field of medicine called functional medicine that looks deeper into the body, at how the body's actually functioning at biochemical levels, at a nutrient deficiency type level, hormone imbalances, the impact stress is having on your body. And so do I have a general stay young plan, optimal aging plan for every single person? No, because it's extremely individualized. It depends what's happening in a person in their life now and what their history tells me. And from that, we create an individual path towards investigating what's wrong and then coming up with a plan to help them reach their optimal health.
So a typical profile may be somebody that's motivated to feel well and take care of themselves, coming in, doing a variety of tests to look, as you said, beyond the normal testing, come up with any deficiencies or other areas to strengthen, and really coming up with a customized plan. That's kind of the
Absolutely.
21st century approach to wellness.
Yes, we are really moving towards a personalized approach. There's a lot of information coming out about the impact of our genome. What does our genome tell us about our health? What is our microbiome? What do our bacteria in our gut tell us about our health? And then, of course, this idea of epigenetics. So what is our environment? How is how we're living our life impacting on our health? Because that's where we can really start to make a difference. So, for an individual person coming in, I'm not a fan of doing 100 tests up front. I think it's important to recognize that this is not a one-shot deal, that it's an ongoing relationship, and that it's a journey to continually strive to feel better or feel your best.
Right. The other thing I know you're very active in is collaborating with more conventional, traditional approaches.
Absolutely.
Could you talk about maybe an example of that?
Sure. So, I trained at the University of Chicago. I did medical school and internal medicine training there before I did my fellowship in integrative medicine. So I come from a very solid, evidence-based Western approach, which I think allows me to then collaborate because I can speak the same language and I recognize the value. So in integrative medicine, we're not throwing out Western medicine. We're just recognizing there's a value to looking beyond it. Some of the things that we've been able to do at Northwestern that I'd say are the most successful, and frankly, that's growing day by day. The first major collaboration was with the Robert H. Lurie Comprehensive Cancer Center. And we received a generous philanthropic donation that allowed us to offer free services to patients who are diagnosed with cancer. And with that, patients were able to receive outpatient services like acupuncture or naturopathic medicine visits, as well as in the chemotherapy suite. We are now able to offer free acupuncture, massage, and healing touch to all patients who are undergoing chemotherapy. And we know that acupuncture in particular has been demonstrated very strongly to decrease nausea and vomiting in patients who get chemotherapy, and studies are suggesting it also decreases fatigue, which is a common problem. So that's a kind of collaboration where there was a lot of skepticism when we started 5 years ago, but we have full buy-in and really a lot of support from the cancer center, and patients just give unbelievable feedback. So that's one example. We have other collaborations ongoing with cardiology, with the women's health programs, with musculoskeletal health programs, and then there's extreme interest in the medical school, which is very exciting, because one of the things we really want to do is train the next generation of doctors to recognize the value of this. So we're working with them as well to create an integrative medicine longitudinal curriculum.
That's exciting. So given all of the exciting things and the collaboration going on, I mean, what is your bigger picture vision of how integrative care, integrative medicine carries forward and changes healthcare in America?
There's been a definite shift recently. I think many people would say we're at a tipping point. We have reached that tipping point. There was so much skepticism about integrative medicine, and it was viewed as woo-woo, or using crystals, or placebo. It was all attributed to a placebo effect. But at this point, integrative medicine is in most major hospitals to some degree, most academic health centers to a great degree, and there's integrative medicine curriculum in again the majority of medical schools. So where I see this going is that I think eventually this will just become part of medicine, and while I hate to say it, I think our specialty will go away, because really if something works, if something works, it works. And if acupuncture works, or if a dietary supplement works, that's what we should be using. If you can do a preventive test that costs a little more money up front but saves many dollars by preventing disease down the road, then that's what we should be doing. And you and I both know that our U.S. health system is in a major crisis. And the only way that we're going to make a difference is by shifting the focus to wellness and prevention and not being a reactive system.
Yeah, absolutely. Well, keep up the wonderful work, and I want to thank you for your time today.
My pleasure.
All right, thank you.
Thanks.